Hi, everybody. Welcome to the CoronaSphere Lounge. I'm your host, Bill Whittle, back at our usual place here in the plane of infinite despair, and just kind of a short show today. Nothing terribly big in terms of the overall news story. I try to keep the politics to Bill Whittle now, so we just a few moments ago shot an episode of that regarding the failure of the COVID-19 bill to pass, but I'm not going to talk about politics here as much as I can anyway. So today's episode is called The Two Timers. And what I'd like to do is just talk and get a little bit of feedback from our live stream. We love to have people watching it live. And let me kind of give you an idea of what the premise of The Two Timers is. So right now, this is the 23rd of March, 2020. Right now, we are in the middle of this, in California, a lockdown. Several other states are in full lockdown. Whether or not other states are going to or not, Great Britain went into full lockdown earlier today, I want to say. And so, as we've said before on this show, this social distancing is saving lives. There's no question it's saving lives. And the other thing it's doing is hurting the economy, and it hurts the economy badly and hurts it worse every day. So that's why I want to talk about this in terms of the two timers. We've got two timers running right now. One of them is, how long can we stay with this enforced social isolation, which is necessary certainly in a place like Los Angeles and so on. As the epidemic starts to hit its peak and as it starts to hit that exponential curve, this social distancing is certainly a circuit breaker that gets thrown. And I don't think anybody knows how much it's going to cut the rate of infection, but it's going to cut it significantly. And again, the entire purpose is to basically stretch out the length of time it takes for people who are going to get infected to make sure that there's no spike in cases that is greater than our ability to handle them at hospitals and so on. So we've been all over that before. So that counter is running, and every day that clock is ticking, we're saving lives. So that counter, ideally, we're talking about ideals now to understand where we're trying to go. Ideally, the social distancing clock should run forever. We should keep up social distancing for forever. And that will minimize the amount of spread and contact and so on. And that's the maximum output for saving as many lives as possible until we find out that we're below the ability of our hospitals to care for people. The other timer is the economy timer. And that timer is running in the opposite direction. The healthcare timer, every second that goes by, is saving lives. We want to run that as long as we possibly can. The problem is that the other timer that starts at the same time as all of this social distancing is the economy timer. And every second that timer runs, things get worse. And there's going to come a time when running the protecting lives timer is actually going to hurt more lives than they save. Nobody really knows when that is, and nobody really knows when it's coming, but I think it's a useful way to think about things. And the thing that I would like to talk about today, and we have so many smart people in our comment section, with a few notable exceptions who I know by name, and you know who I'm talking to. What I'd like to do today is just see if we can get our heads around the idea of running these two timers in phase, synchronized with each other. So what do I mean by that? Well, Bo Monday, you called yourself out. I'm not, I love interacting with the group we have here. It's great people. So when I talk about running both of these timers together, what do I mean? Well, what I mean is how can we get the restart the economy timer going as quickly as possible and not, or at least interfere as little as possible with the public health timer, which is a good thing. So how do we mesh these two things together? And I don't think I've heard anybody talking about this. All I seem to have been hearing, at least in the main, is people debating how long we should go before we switch. How much of the healthcare timer should we let expand to save as many lives as we can? And at what point do we stop that timer and start the other timer, which gets the economy going again? And obviously, we are looking forward to the day when we don't have to do any of this and go back to at least whatever the new normal will be. But the thought occurred to me, and it's going to be a relatively brief show today because it's just a simple thought, but we should be able to mesh these things. We should be able to shuffle them. In other words, we should be able to start taking actions now. I'm not talking about me, I'm talking about the government, I'm talking about all of this stuff. We should be able to start taking actions now that 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 can restart the economy timer. Get that economy timer at least operating on some level. Let's just say that where we are now, wherever we are now as of Monday, we've had social distancing enforced in California since Thursday, and we've been doing it considerably since, and so we're at least a week in. I think if we just take today, 23rd of March, as an economic baseline, this is the new economic baseline just for the sake of the argument, and this economic baseline is hurting the economy, it's killing the economy. It's just really, really hurting, and every day that goes on, more damage becomes irreparable. So if we assume that this current baseline is a zero marker, certainly if we could increase the economic activity that we have now by, let's say, 10 or 20%, that's better than where we are now. 20% of something good is better than 0% extra of something good. And at the same time, we don't want to interfere with that timer that's running to keep people alive through the social distancing. So what do I mean by this? Well, I guess what I mean by this is how much of the economy can we restart while maintaining the social distancing quarantines that are saving people's lives. I'm not calling for any of this because we're dealing with legal authorities now, but I am saying that we should be having this conversation and we should be having it quickly and widely. What can we do in order to get as much of the economy going as quickly as possible with essentially no or very little risk to the good things that are being done by the social quarantine? So, for example, if you have an office filled with 10 people and they all work 9 to 5, could we not split that into 3 shifts of 3 people each? Certainly, an office that's designed to hold 10 people can hold 3 people within the 6-foot radius. I understand that rebreathing the same air and stuff is problematic, and that may not be a great idea, it may be a terrible idea, but certainly, there must be some way for us to be able to restart this economy as much as we possibly can. If you had a restaurant that held 100 people, could you let in 5 at a time, in 5 tables instead of 100 tables, and they're all spaced out, and you sanitize the tables after that? I don't know, but these are the questions we should be asking, because I don't see any reason why this has to be a black and white, on and off kind of thing. Again, it's so great to have a comment section here. And Martin Archer, who just made this point, is we are allowing drugstore personnel are working. We saw a woman last night working the drugstore late at night, and I thanked her. And I thanked the 7-Eleven guy, too. I thanked him for being on duty, and because they're taking a risk. They're doing it to keep their businesses open, but certainly if you're a 7-Eleven clerk and you're dealing with, several dozen people a night, if not 100 or more, you're at risk. And those people are at risk, and they kind of have to be at risk because grocery store clerks who are at risk, people who check out groceries are at enormous risk. And we're ready to accept that risk because we have to get the food and so on. So all of these people who are taking risks to be at work now are I've been very careful about overusing the word hero. I don't want the word hero to be degraded. It's like a person taught elementary school for 30 years, they're a hero. I don't quite extend that term easily. But in these cases, we are genuinely talking about people whose health and potentially their lives are at risk. And they're out there doing the jobs we need to because we've decided that those are essential services. So then the question is, what can we do to incrementally start the economy? And how would that look? In other words, what kind of a business and what could existing businesses do to restart, even if it's a 10, 20%, 30%, 50%, whatever? What can we do while maintaining public safety to get as much of the economy going as quickly as possible? Certainly, I would imagine a restaurant would rather have, on a busy day, if they have 100 tables, they'd rather have 10 than none. Is that possible? Can that be done? I know a lot of this depends on the actual medical research, and I don't have the answers to these questions, and I never have pretended to. But I think you could probably make the case that if you had an absolutely enormous restaurant, for example, let's say a Denny's, something big and wide. I know Denny's is not like the biggest restaurant in the world, but everybody knows what a Denny's looks like, so let's just say a Denny's. And again, I'm dealing with hypotheticals just for the sake of it. Right now, you could go into Denny's. Again, I don't know if this is true for Denny's, but just hang in there with me, folks. For pickup, which means I can open the door to that restaurant, go to the counter, order food, stand there, wait for the food, pick it up, go home, and that's good. And so the question then becomes, again, we're speaking theoretically to understand the problem. If I were to go into Denny's and sit in a booth in one corner of a restaurant, and somebody else were to come into Denny's and sit in a booth at the farthest corner of the restaurant, would that, in any statistically significant way, increase the risk of infection? Obviously, on some level, mathematically, obviously, it does increase the risk to some degree. But if we're agreeing, as a public health issue, that a 6-foot diameter, a 6-foot radius rather, is considered safe, then could we not come up with some kind of intermediate guidelines to say that as long as the tables were 10 feet apart, as long as there was a hand sanitizer available coming in and out? I don't know that any of these solutions that I've mentioned are viable, but without question, there are alternatives that are viable. And I think we ought to be thinking about these things right now. We ought to be thinking about them right this second. What can we get online, and how can we get it online as quickly as possible? And it makes me wonder about what other people think about this, because again, we got a bright team of folks here, and I'm wondering what they have to think about this in terms of their jobs or other jobs. The one thing I do know, and this is the factor, is that clearly the risk of infection goes up not just as a function of how close you are to other people, but also as a function of how close you are for how long. And then you get into things too, like recirculated air and so on. One of the reasons that cruise ships have traditionally been kind of prone to have outbreaks, although they're exceedingly scarce compared to the actual number of cruises. But the reason they occasionally happen is that they have to recirculate some of that air on the ship, because most of the inside of a steel container is not surface area. So what do? Could we safely run 3 shifts? I'm asking, I don't know. But if we had an office building, could we take a look at that? Would it be essentially safe enough to run them on 3 different shifts and have a, just like in wartime, you got a swing shift, you got a 9 to 5, you got a 5 to 11, and I can't add anymore. I'm past it. What can we do? I think that not only is it important that we restart as much of the economy as we can while maintaining these social quarantines, I not only think it's important for the economy, I also think it's important for people's morale and their attitude. Um, what do we do about it? Um, I don't know, but there must be something. So I'm curious to know if anybody in the comment section has anything to say about that. Certainly, the swing shifts enormously help production, but swing shifts to increase production are not at risk of propagating disease. We went to 24-hour shifts because we wanted to make more stuff. It doesn't mean it's more sanitary by any means, but in any case, you get it. Uh, John Persing says that SpaceX model for the Starship production is 12-hour shift, 3 days on, 4 days off, and then swap, running 3 shifts every day that way. Is he doing that now? Um, it's it's a question we need to ask. And certainly jobs that don't require people to be in as close confines are jobs that could be more likely to be restarted ahead of schedule. And maybe the better way to think about this is to think about the inverse of this. Maybe that's the way to think about it. In other words, I just did a Bill Whittle Now episode, and Scotty asked me if I thought it was a good idea that all of Britain get locked down. And this point that I'm about to talk about, I didn't bring this, I'm not the person to come up with this, but it addresses the issue of what we're talking about. And the point is this: if the governor of California issues a statewide lockdown order, from a purely scientific point of view, that's certainly not fair to people who live in the country, who live on farms. Their freedom of motion should not be limited by this because they're not exposing people the way that people are getting on a subway as they are in New York or something. And the point I brought up about this um, is that you can kind of think of it like the speed limit. Uh, the speed limit is the limit at which the worst driver in the worst maintained automobile can more or less safely navigate that particular stretch of road. If you've got a better car and you've got faster reflexes, you got better training, you can certainly safely drive faster than the speed limit if you have those advantages. But the problem is you can't make the law granular enough to say that every single person gets a different speed limit based on how good a driver they are and how good their car is. So when when you talk about locking down a whole country, you're talking about locking down a country because you want to break the social contact that happens in the cities and in mass transit and all the rest of it. And no one can get granular enough with the law to say people within this area and so on. One of the things I mentioned just in passing on the show we did today is that one of the possible outcomes after this is all over is that we may end up assigning neighborhoods and areas sort of a biological kind of a contagion factor. For example, any place that's like a downtown city where you have just masses of people on a subway or something, you could call that a level A zone. People live in suburbs, you might call that level B. You might people in the country, you might call that a level C zone. And then you could then issue quarantine orders appropriate to the zone. There's no way to do that now, and we shouldn't try to do it now. We're in the middle of a crisis now, but there's something to think about coming out afterwards. So maybe the way to think of it is the inverse, not so much what can we start immediately, but what should we not start if we were to start immediately? What things should we clearly say are not allowed to happen? I don't have any answers for this one. There's a lot of times, well, we've been doing 4 whole shows now or something, but sometimes I come in armed with all kinds of data and information and news, but this one was just more of a philosophical issue. And the final question really is, how do we protect ourselves against people that are just plain being complete jerks about this? Cheaters, what do we do about that? The people that I've seen, the people that I hang out with, and I think this goes back to an essay I wrote in 2003 called Tribes, 2005. The people who I like to hang out with are serious people, the practical people. They don't panic, but they do know that there are some things that deserve respect and a certain amount of fear, and they put the fear in those boxes, and then they do something about the boxes. So if 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 we were to have an entire population of people who are fully responsible, we could probably get most of the jobs back pretty quickly. Most responsible people would do things like use the hand sanitizer and masks and so on. We could certainly restart more quickly than that. But then what do you do about the cheaters? Because it's one thing if somebody cuts in front of you on the freeway and they use your ramp ahead of you. That's annoying. That kind of cheating, that kind of social cheating goes on all the time. When you're dealing with a pandemic, it's kind of like saying if somebody cuts you off and takes your place on an exit ramp, everybody on the highway dies. That's that's what we're talking about. Yeah, the spring breakers, they're not. I have to remind myself on a depending on how upset I am about things, either a daily, an hourly, or a second by second basis, that these kids didn't ask to be raised this way. That all of this selfishness and all of this lack of not only compassion but perspective and me, and I want it right now. They didn't raise themselves. We watched this happen. We watched everybody get the participation trophy, and we watched people having kids throwing temper tantrums in toy stores, and then finally buying the kid what they want because they made enough noise. We watched students protesting things, ridiculous things, and watched the university just bow down before them and give them everything they wanted. So why should they listen to the rules? They've never had to listen to the rules before, these spring breakers and stuff. It's not their fault, but nevertheless, they're a big part of the problem. And so I just think all of these issues are things that we should be actively talking about and talking about them now, because that economic clock is ticking, and it can't go on ticking forever. Martin Archer says it's a 10-minute COVID-19 test developed in Korea becoming available. That's great. Just yesterday, Donald Trump was talking about a 45-minute turnaround on a test. And so all of this stuff is better. And then just the final question on this. Again, this is just a throwing thoughts out there kind of show. But this was one of the first thoughts I had. If it turns out that recovering from this disease gives you immunity, it may not be long-term immunity. That hasn't been deciphered yet. We went around that whole cycle I think on show 1. But let's say, for the sake of the argument, that if you come down with COVID-19 and you recover from it, let's say that you've got immunity for a year. Again, for the sake of the argument, would there not be some advantage? I don't believe in government coercion under any circumstances, so I'm not talking about this being forced on people. But if you had the disease and you didn't, it's a different kind of test. Not that if you tested positive for being positive with COVID-19, but if there was a way to test that you have it, you recovered, and you've got antibodies. In other words, if there was a way to show that you were immune, would there not be some kind of advantage to some kind of a Green Party bracelet or something that's administered by a healthcare official or something that you could wear for 2 or 3 months, and you got this bracelet, and this bracelet basically says, okay, you're immune. That means you can go to work. I'm assuming that immunity follows the basic kind of immunity for other diseases. Right now, I'm not concerned with the length of it so long as it's at least a couple months. So it may not be permanent immunity, but just stay with me on this. Would it not be valuable if there was a way for people who had medical proof of immunity to be able to go out and go back to work? Because not only can they not catch it, they can't transmit it. This is the kind of thing I'm talking about when I talk about trying to mesh these two timers together. We've always been thinking, and we continue to think about this as a binary kind of an on and off thing. We're social quarantining and the economy's dying, and then we flick the switch and we go back to the economy, and then all the social quarantining goes away. But surely there's got to be a way to fade this thing. And it seems to me that some kind of medical proof of immunity would be an extremely valuable thing to have. And as the caseloads increase, and what we do know about this disease, we don't know the exact numbers yet, but we do know, I think beyond any question, that most of the people who contract the disease make a full recovery and are fine. As the number of cases increases and as the number of sick people increases, the number of recovered people also increases. And if we're facing an exponential wave of sickness and infections and symptoms that are still coming as we're on the upside of this curve, why don't we look on the bright side here? Why don't we look on the bright side and say that 9 out of 10 people who are now in this stage are going to recover and they're going to be immune, at least for some period of time, unless I've really, really misunderstood this. So I know a lot of that depends on whether or not you can be easily reinfected. It doesn't seem to be a lot of data that you can, but nevertheless, imagine that there was a fairly tamper-proof means administered by a medical professional to say, yes, you've got it, you've had it, you've got antibodies for it, you're immune. If you're immune, you can go and patronize a restaurant. And if you're immune, you can work in a restaurant, and you can work anywhere, because if you're immune, you can't catch it and you can't give it. So that's all I really want to talk about today. I don't see any reason to extend this out any longer than it needs to be, but we have to start thinking outside the box, and we have to start thinking about new approaches to things and making these new approaches happen fast. I will say, I thought that the president's been doing a real good job of moving resources where they need to go, and we can certainly do that. And of course, the real irony is that when you see how fast things can happen in an emergency, you wonder why they, do we have too many safeguards? Do things move too slowly in terms of bureaucracies? I'm inclined to say yes. Notorious BEN says one of the things he finds most humorous is that there's suddenly people who've been gun control advocates for their entire lives, and now they're out buying guns, and they can't. Speaking as somebody who lives in California, and speaking to people who have lived in California longer than I have, this is a common thing. People will talk about that if you could just get rid of guns and you get rid of murder, and what on earth would you possibly need a gun for self-defense? And in times of crisis like the Rodney King riots, or immediately after earthquakes or things like that, all of those people start calling their conservative friends who they've been excoriating the whole time and say, hey, do you have a piece I could hold for a couple of weeks until this stuff dies down? But I'm not seeing any of that out there. I'm not seeing any of it. And if we start to see signs about it, we'll talk about it. Yes, I know I just touched my face. But I used a hand sanitizer before we got the show going. So anyway, it would be great if everybody started thinking about this, because the one thing we're finding, I think, so far, the one lesson that really seems to be coming in solid from the beginning is that it is the public sector and individuals that are going to do the real work of getting us through this as painlessly as we possibly can. I don't expect to see any kind of innovation along these lines from government agencies. What I do expect is to see what we're seeing now, which is people who don't manufacture respirators, but who could manufacture respirators, stepping up and saying, hey, you want some more respirators? We'd be happy to make them. So that'll do it, really, for this edition of the CoronaSphere Lounge. I'm going to be here every single day at 6 o'clock Pacific, 9 o'clock Eastern. And I suspect in the near future we'll start taking more questions and dealing with that aspect of it. But for now, I think it would be good for everybody out there to give serious thought to what could be done to safely restart not only the jobs that you have, but jobs you may know about. What could be done incrementally to make as much of this economy get going, so it's not just it's off, now it's on. What can we start now without significantly increasing the risk? And I think a lot of thought needs to be given to immunity. I really do. This, just to recap, I think this is a really important point. there's not going to come a point when all of a sudden this is how the law is treating it, this is what we're expecting from the government, but it's not how it's going to work in terms of biology. There's not going to come a point when it's like, okay, now everybody's good to go. That's how they'll lift the law, but we shouldn't be thinking that way. We should be thinking right now there are people that are good to go. Those people have just recovered from the disease, they're immune. And again, just to recap, as the caseloads start to increase dramatically, number of immune people are going to increase at a ratio of 9 to 1 or something along those lines. And then we got to find a way to make sure that the people who've got the immunity can get back to work. And instead of just turning the system back on again, if one person in an office of 10 can go in and get work done that couldn't have been done otherwise, it's better than nothing. And I'm sure there's a lot of people out there would like some overtime, given how much they've had to take in terms of time off. Anyway, something to think about. Main thing is to be talking about it and discussing it and being calm and cool and trying to figure out what practical things we can do to save as many lives as possible at the lowest possible cost in terms of economic damage and all the rest of the cost. So, yeah, that'll do it for this edition of the CoronaSphere Lounge, which is made possible by the members of BillWhittle.com. We've had a big spike, according to Scott, in Patreon folks. So we'll put the Patreon link right below here for people like to make a one-time donation or something on YouTube. We're very, very grateful for the support, and we'd like to be a continuing beacon of hope, good news, tempered by a realistic look at what's happening and a critical look at the authenticity of the data that we may decide constitutes good news. So that'll do it until tomorrow. We'll see you tomorrow, Tuesday at 6 p.m. for episode 5. This is the CoronaSphere Lounge. I'm Bill Whittle. We'll see you tomorrow. Bye-bye.